This is LiveWell Talk on lung cancer screening. I'm Dr. Dustin Arnold, Chief Medical Officer at Unity Point Health St. Luke's Hospital. Lung cancer is the leading cause of death in both men and women. The best way to prevent lung cancer is to catch it early prior to it spreading. Joining me today on the podcast is Mallory Kaemmer, radiation therapist and supervisor at St. Luke's Nassif Radiation Center, to tell us more about lung cancer checks and who's eligible for such. Mallory, welcome.
Thank you. Thanks for having me.
What is a radiation therapist?
Radiation therapist is someone that delivers radiation treatments to cancer patients. So we get them in the proper position depending on, the area that we're looking at, get them as comfortable as we can. And the area open and kind of spread out, like say, we're going to treat your lung or your breast, your arms are above your head so that it's not actually in the radiation treatment field.
So kind of like a radiology tech.
Yeah.
But instead of taking a picture, you're blasting them with radiation.
Yeah, so we're trying to kill the DNA cell of the tumor. In radiology, you're diagnosing, so you're getting a pretty picture for the radiologist.
How do you become a radiation
So therapist? I did go to X-ray school before radiation
Okay.
therapy school. So, and then that's a modality, just like CT or MRI or nuke med is a modality of radiation therapy. So it's more schooling added on to
Sure.
it. So you kind of figure out in X-ray school if you want to move on or if you want to do that.
Kind of like some of the cath lab people, they started out in X-ray school and then used fluoro and then just ended up working in the cath lab. Interesting. I didn't know that.
Yeah.
I mean, I knew people position them, but I really didn't know that. So I learned something today. So now that we know what a radiation therapist is, and we want to talk about lung cancer, what is a lung cancer check?
So it is a CT scan. We actually do them in the cancer center, but we use our CT scanner. So it's a low-dose scan. We kind of set up our parameters to the machine to ensure that it's a low-dose scan. So we start at the top of your lung and go through your entire lung. That patient's holding their breath throughout the treatment, so we know that they're holding nice and still. So what ensures that low dose is it kind of goes on how long your lungs are, how thick your chest is. So we do the lowest dose possible to get the prettiest picture. So you have to realize too, your heart's in there, and smoking does play a toll on your heart.
So when you say low dose, what's a normal CT scan of the chest?
Like dose-wise, what you'd get. So you'd get a little different dose than I would get. So it's not
so you
set
just
in
called
stone.
You just called me fat.
No, I'm saying your broad shoulders and
Okay,
your chest is bigger than mine. So to actually bring your arms up, and so we'd scan through your chest, and so the dose isn't set for each, but they wouldn't stop right at their lungs just for a CT of your chest.
So it is variable per patient.
Yes, it is.
And so how do you determine that? Do you take a picture and say, okay, we got a little bit higher, okay, there we are. Is that how you do it?
Yeah, so we do an initial, we call it a topogram, but it's just a quick scan of that patient's lungs. So then we set our border for the actual scan on how high we go and how low we go.
And I'm sure after a while you're kind of you kind of get a pretty good idea where to start, I bet. Yeah, okay.
For sure.
Well, I mean, let's keep talking about radiation in that standpoint, because it would be easy to say, well, let's just scan everyone and for lung cancer. Let's just, put them out at the mall and just have everybody get a CAT scan. But that would expose them to unnecessary radiation, correct? So what is the criteria to get a lung scan?
So it has expanded a little bit. So the age starts at 50. And goes to 78. So that's kind of the age group that we're working with. They have to have a 20-pack year history smoking. You have to be a former smoker or a current smoker. And if you're a former smoker, you have to have quit within the last 15 years. So it kind of cuts off insurance, sort of quits paying for it at that. No signs or symptoms of lung cancer is another.
A pack year, we should let the listeners know, is the number of cigarettes you smoke per day for a year. So if you're a 15-pack year history, meaning that you've smoked 1 pack of cigarettes a day for 15 years, or 2 packs a day for 7.5 years. Correct?
Yeah, thanks for clarifying that.
Yeah, that's a lot of cigarettes.
That is. Yeah, and it used to be 30, and now it's down to 20. So that kind of opens it up. So, and it's important too to get that first one, whether you hear about it today or you just turned 50, but to get that baseline. So a radiologist is always comparing to that first one. So if there's any spots or areas that are a little bit suspicious, they can look back to see if there were changes in that. And so that's really important in diagnosing any nodules or cancers. Not saying all nodules are cancerous, but definitely being able to compare that and the changes is for the early detection is super important.
All right, let's play guess how old people are game. How many slices was a CT scan when you were in school?
Slice thickness, like, or
how many slices could it do?
Well, you can kind of change what that is, but like the shorter and thinner the slices.
Yeah, I mean, do you remember what it was when you went to school?
No, because I only went to school for x-ray. I didn't actually work in the field or anything.
Like when I was a medical student, they were 16 slice. So then it went 32, 64, 128. I don't know what they are now. So there was a time when you had all these nodules showing up because you were missing them before. Does that make sense?
Oh, I see. Like the slice thickness was a little bit too big, so now we've condensed it so it's a lot more detailed.
Yeah.
Maybe a little more radiation, but definitely more detailed, which at that point you'd rather have.
Right. I mean, it's all positive, but but it did change things when you just went from this very seldom having nodules to all of a sudden everything was a nodule. And I remember that transition, and I'm sure people got extra CT scans to make sure it's okay, but I think at the end of the day, it's a better test and better anatomy and picture for us. So insurance covers this. All insurance is Medicare?
Yeah. Yep. So, and you can't have a CT within the last year or two, or else they can pull that CT scan and just look at that. So kind of if you meet the criteria, you have insurance, it should be approved by that. And so it is so detailed too that it is, like you were talking about with the slices, a very good image of your heart. I've had plenty of patients say, well, you saw something on my heart the last time, so they did all these extra tests, and either they found something or they didn't find something. So I thought that was super interesting too on the
well, that's always been the concern with screening tests, that not only radiology wise, that you're going to expose people to radiation they don't need, or you're going to start a cascade of tests that could have a complication. So you see a nodule, it leads to a biopsy, turns out it was benign, but yet they had a pneumothorax or a collapsed lung, and that has to be treated. So that's always been the concern, that if we just screen everyone, you'll have more complications than you would have had for the number of cancers you diagnosed. Does that make sense?
Yeah, like the benefit outweighs the risk of it.
Yeah. So but it's like a lot of things in medicine and in life too, but if something's 1 out of 1,000,000, but you're the one that gets it, well, then it's 100% of the time for you, right? You don't take a lot of comfort knowing, well, at least there's, 999,000 people that didn't have it, So that's always the mental gymnastics I think we do, that if you're the one that has it, it's 100% of the time for you. But with the tumor marker and the genetic therapy for lung cancer, finding it early is the best treatment right now.
It really is,
Yeah.
Because, stage 1 is definitely manageable with either removing some of your lung or immunotherapy. And stage 2 is absolutely too. Stage 3 is considered, in your lymph nodes. So at that point, they take a different approach. And stage 4 is really scary.
Yeah.
So, and sometimes, the 20% of the first and second stage have 0 symptoms. So people just come in, for their lung screen thinking, I'm just going to check out my lungs, and, then they find something. So it's so important for these screenings and to get on top of it when you can.
And we all know, I had one recently in the last 6 months, never smoked, reasonably healthy, just shows up with some back pain, finds out metastatic lung cancer.
Yeah.
We all have those cases, but they're pretty rare, thankfully.
They are.
And certainly it's always sad when someone has lung cancer and they never smoked. But a majority of people smoke. I think it's 40% of people that smoke end up developing some sort of lung malignancy for over a period of time.
It's like COPD or
COPD actually
chronic.
is a minority of patients. I know in the healthcare we just think everybody gets emphysema or COPD with smoking because that's who we see. But it's only about 15% of the people that smoke develop COPD or emphysema. And what's interesting, not that people shouldn't quit smoking, but it probably happens with the first cigarette you took. It triggers that cascade of damage to your lungs.
Interesting.
Yeah, the patients, like, there's a genetic susceptibility to it, particularly in Taiwanese, that like they have a higher incidence of emphysema, and they think it's a genetic sort of cluster that when they smoke, they trigger that. And smoking is very common in Asia and Europe. You don't see people smoke around here like you used to, but
right.
But certainly it is still present. It's always sad when I see a young person smoking. I'm like, oh gosh, So
they used to market it, I think, back in the 70s.
Oh yeah,
pregnant women were smoking, and it was no big deal, and it was good for you. So
yeah, the 9 out of 10 doctors recommend Camel cigarettes for asthma or something like that. But here's another kind of funny story along those peculiar. When I was in high school, I played fast pitch softball out at Ellis Park, and the guys on the team, they'd like run to first base, and then they'd start hacking and coughing, and then come in the dugout, and smoke a cigarette and quit coughing. And I used to think, that is so weird. But then when I was in medical school, there's atropine and scopolamine that's in the cigarette that helps dry out their lungs. And that's why a smoker's cough sometimes responds to your first cigarette in the morning. And so I always found that kind of unusual, that you're coughing and hacking, and so you take a drag on a cigarette. But it's actually basically like asthma medication. So I think that's where this asthma cigarettes came in vogue in the 1950s and back then.
It dries your lungs out?
Right. The scopolamine and the atropine act as an anticholinergic and dry up makes your secretions dry, so it would stop the mucus production temporarily.
Because then there's, I forget what they're called, but they're kind of like all in your throat, that once you smoke a cigarette, you kind of like burn them out, and then you can't cough up what you need to, like the mucus. So it kind of just like
your mucociliary clearance becomes damaged. Yeah, no, that's fine. And that's another reason why there's a little science behind chicken soup helps with a cold and a cough, because it keeps you hydrated and it allows those little microciliary to work better.
Interesting.
All the listeners are Googling, microciliary in Taiwan right now. So how do I get so okay, I'm a smoker, and we're going to come to stopping smoking, but how do I contact you to get do I need my physician to contact the center?
Either one. So your primary care doctor, if you see them regularly and go in for a physical and you meet the criteria, they should be ordering that lung screen. And once you have an order, we can get it scheduled, or that office calls and it gets they schedule it for you. But our lung screening number is, I have it here, so it's 319-861-6949. So if you're within that criteria and your doctor's giving you an order. A lot of our patients do see a pulmonologist regularly too, so they order a lot of our lung screens, and so do just the PCPs, around the area.
So you can call that number yourself and get, if you meet the criteria.
Yeah, and if there's an order in from a doctor as well.
Okay, so you do need an order.
Yep.
All right, got it. Well, the best way to fight lung cancer is to reduce your risk for it, and the highest risk that we know of is cigarette use, nicotine. Mm-hmm. So how do you encourage people to stop smoking?
So when they come in for a lung screen, we kind of talk about where they're at with, if they're ready to quit, if they want to quit, if they're so far and don't want to quit at all, like have zero interest in quitting. So we give them a smoking cessation packet. There are a few numbers, like a 1-800 number, 1-800-QUIT-NOW. And so there's some motivation with that, with when you want to pick up a cigarette, you pick up the phone instead and call them, and they can talk you through, not smoking that cigarette. And there's, a lot of different things that go along with quitting smoking, whether it's like hypnosis, you've heard of that, but we kind of just keep it at that, and some resources for them to quit if they're interested in quitting.
That is of value, of course. I've always found in my career that it's one, you have to determine what sort of smoker you are. Is it an oral hand fixation, truck drivers, something to do while they drive, or is it stress, etc. But nicotine's a drug. You're addicted to it.
Addiction, yeah.
I've always encouraged patients. Let's say they smoke a pack of cigarettes a day, which is 20 cigarettes, I think. I've said, okay, go down 2 cigarettes every 3 days until you stop smoking, rather than just going cold turkey, so to speak, because that's less likely to work as far as nicotine desire.
And all the lung screens that I do talk to the patient about that, and we kind of rank them on a 0 to 10 on a scale, and so try to encourage them to quit, and kind of feel out where they're at, like we had talked about, if they're ready, or if they're going to laugh at me and say there's no way, lady, that I'm going to quit smoking. So
well, and I think as a professional you have to have that conversation, but not belittle them, because that doesn't accomplish anything,
right? More encouraging. I feel like.
Absolutely. That motivational interviewing, I think, is the discipline they call it. But because I think most people do want to be approached in a constructive way and not be, talked down to or scolded. That's the term I'm looking for. Nobody likes to be scolded.
Right. And a lot of people, it seems like, they're really trying. They're actively trying, and whether they do need encouraging, or someone to motivate them, or someone to just talk to about it too, that's helpful, I feel like.
My dad was a big smoker, 2 to 3 packs a day, died at a young age, directly related to that. But it was, he tried so many times, so many different things, just it was difficult.
Yeah, both my parents actually smoke, and we've lost an aunt and an uncle, my aunt and uncle, to lung cancer. So diagnosed at stage 4, and gone within 4 months.
Yeah.
So just, the toll that it takes on a family and a person, and, he had young daughters, and so, that's why I am passionate about it too. So
yeah, how did you get it? Why radiation therapy? How did you end up doing that?
So
you told us how you become one, but why?
Yeah, so I started in X-ray school, and I did like that, how we talked about sort of diagnosing rather than treating. So with that too, it is, you learn a little bit about a patient, and then you send them on their way. So with radiation therapy, you get to know them. You start to have conversations daily, whether they're feeling good, they're feeling bad, and you develop like a friendship, And I think that's what made me come into radiation therapy, because you get to know them. And I'm a social person, so that makes me feel good too. On top of that, maybe they don't feel good, but a lot of times we do, there are jokes and we laugh, and they come in later for different scans and stuff, and they're saying hi to everyone. And, there is some fun to be had too. So we're not just all...
First of all, I think I hear nothing but good things about the crew over in the radiation therapy there.
Yeah, it's a great crew.
Yeah. Starting right with Joan Huggins,
right?
Yes. She's amazing.
She is so great.
Yeah, her daughter played basketball with one of my daughters. So we've known Joan a long time. She's just a phenomenal person. But I've never heard a negative thing about you guys over there. It's always positive, which is outstanding.
Yeah, it's a great group, that likes to come to work every day, and we're having fun over there and taking care of patients and enjoying their company. I think that is, a big thing. And that's what they need sometimes too. They're going through some hard things.
Yeah, if you don't like people, then you probably shouldn't be in healthcare.
Yes, for sure. And helping people too, that makes people feel good, with COVID coming up and being a little bit more isolated and not having as many social interactions. Some people don't do well with that, and so knowing
I brag about St. Luke's all the time, and it's not just because I work here, but we do have a culture where we we believe in helping people and we behave as such. And that's a good culture when your beliefs and your behaviors line up, good things happen. They really do.
Absolutely.
Well, thank you for joining me, Mallory.
Yeah, thank you for having me.
Even though you had a hard time finding the studio today, but you can plan for next time. Thank you again for joining me, educating our listeners about the Lung Check program. Once again, this is Mallory Kaemmer, radiation therapist and supervisor at St. Luke's Nassif Radiation Center. For more information about Lung Check, visit unitypoint.org/lungcheck. If you've been diagnosed with lung cancer or any other type of cancer, the Nassif Community Cancer Center is here for you. For more information on their extensive offering of support services, visit communitycancercenter.org. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.